Good afternoon. Thanks for tuning in today. This is Jeff from Brightsquid. Ingrid Rice is with me today, and we're going to talk about privacy considerations for virtual care services. Just quickly go through some of the things that we're seeing in the news and what you need to consider to protect your practice going forward. Before we get started, there's a quick slide about audio. If you can't hear, you might want to adjust your settings. I'll leave this up for a couple seconds. We recommend selecting computer audio if that's easy for you, or you can dial in at the number there. Just select a phone call, and you can use that information to get in and hear what we're talking about. So today's presenter is Ingrid. Ingrid has been doing privacy compliance for, well, since the 80s, I think, Ingrid, is that right? And is a certified expert in the field. She's consulted by privacy commissioners in Alberta and across the country. She's done thousands of privacy impact assessments for clinics and healthcare organizations. So Ingrid's with us today to talk about what you need to do to assess any potential virtual care vendors that you're going to look at. Before we get into talking about what you should be looking for, just to kind of highlight, unfortunately, we're dealing with a tricky situation, and everybody's kind of scrambling to adjust and get the care that we need to provide to patients. And there's some people that are trying to take advantage of that panic and rely on the fact that people don't really know what they're doing around privacy and security, especially now you've got a lot of people working from home. So the vendors that you use, you're going to want to make sure that they are protecting you from the actions of your patients as well, because if somebody clicks on a link in their email and downloads a virus into their computer, their network, or somebody else in their organization gets one and it comes through to them somehow through another link, if you are in your patient's contact list in their email, you're likely going to get a spam coming at you, and the increased risk of that, the more and more of those, if somebody in your clinic accidentally clicks on something, then you can get into trouble. So let's just dive in here. And Ingrid, we're going to talk about choosing a virtual care service, as I said, what you need to know. Can you go through some of these considerations and talk about why they're important and what the laws state in terms of compliance that we need to be aware of when we're looking at these? So this first one is data collected and stored by service. What does that really mean, and does that ever really happen, and what kind of stuff do you need to look for to make sure it's not?
Well, that's for sure. So when data is collected, a lot of times some of these companies are actually recording your medical visit or your patient visit, and some of these are storing this for sometimes they claim purposes such as if you need to recollect it or if you need it for legal liability. But the truth is you cannot be storing and recording this information without proper agreements in place, and you shouldn't be storing it at any rate except for the purposes deemed under the Health Information Act, under relevant acts in your city, town, or county or country. So you have to be very careful when you are looking at this. So please make sure that that is not being collected, and you won't know that unless you read through all the agreements in fine print. So other examples are some of these data that they are collecting, they actually use for third-party purposes, such as advertising or marketing. We had one the other day that we were looking at using or working with, and they end up saying in their agreement that they're actually using it for marketing purposes. So you have to be very careful of that as well. These companies, are they willing to sign agreements such as an information manager agreement or a business associate agreement to be compliant with HIPAA or with legislation? You have to be very careful because many companies aren't going to actually sign off these agreements. So you want to be very careful with that.
Yeah, and I think in that, and that's just a follow up with Ingrid. I think, it's one thing to see what companies write down, but I think, if we were paying attention to the news about a month ago, everybody jumped on Zoom, and then it came out that even though it wasn't written in their terms of service, Zoom was sharing personal information with Facebook for advertising purposes, and they hadn't even said that they were going to do that. So even reputationally and really sort of, I think, driving or interrogating any vendors you're looking at, saying, are you going to do these things? Because as a custodian, you're responsible ultimately for what happens to that patient information.
Right, as a physician or a dentist or any kind of care provider, you have to be able to account for what's happening to that information. And the last thing you need is to see something like that on Facebook, for heaven's sake. So you have to be very careful, and it might not be written. You are correct. So go ahead and ask. Or do some research, because if you go and research the security on these companies, you'll even see where many instances are actually referred to as, oh, actually you can Zoom bomb in this case, or you can actually access Gmail by doing the following. So,
Yeah.
do some research for sure.
That was one actually interesting article you sent out to us internally this week, was about the, how 5 ways you can access a Gmail account, which is pretty scary. So we'll share that after this as well, so people kind of have some awareness around that, and more reasons not to use regular email. And so cyber viruses are obviously a huge concern. What kind of things should people be looking for with their vendors to see that they are being protected?
Well, you can ask a simple question. Can you guarantee my security that I won't be hit with a cyber virus? Can you guarantee that? And you will see very few people that have actually gone through all the background and all the technical regulations to actually protect against a cyber virus. So that's a very good question to ask any of your service providers. And you absolutely cannot guarantee that with Hotmail or Gmail or many of these emails out there, because that kind of investment into that technology doesn't work for the masses. So many of these have not actually done that. So please ask that question for sure. And
Yeah.
even simple things like, can you access and can you audit this information? Because if you audit it, you can see that there's many viruses that are actually coming in.
Yeah, it draws to mind. I think there was a case late last year. Um, a, a, a dental software provider in the U.S. got infected internally, and it ended up impacting around 200 dental clinics across the country, who were infected because the vendor hadn't taken precautions themselves. So you have to make sure that the people you're working with are being safe themselves. And you think about we're talking about viruses and immunity. You have to think about the spread in terms of a community and who you're connected to. You want everybody else to be safe and protect themselves as well. And
Really
so,
relevant in COVID days for sure.
yeah, of
But
course, right?
yeah, and the other thing to point out is you're only as strong as your weakest link. And if your weakest link is infiltrating with viruses or able to transmit viruses, you can imagine how susceptible you now have become. And it's only because you maybe didn't do your homework and discover that. So you're correct.
Yeah, and then I want to talk a little bit about passwords, individual accounts, access to information. Is it auditable? That sort of thing. Why is that important? And what do people need to be aware of?
Well, you all need a unique password and your own account. So examples would be, from a legal perspective or even just from a common sense perspective, if everybody in your household is using Happy Face at whatever hotmail.ca and everybody can access it, all that information is coming in to one place and other people are answering. It's just a huge risk. So you must have individual accounts assigned. And it would be the same as if the reception at the front end of the dentist has all the same passwords for everything and the same people that are using all this generic account like info at Happy Smiles Dentist. So what happens is everybody is accessing that. People are answering random. More people are likely to click on links that aren't acceptable and opens yourself to security hacks. So you have to be very careful and have your own account so that it can be audited and you can determine who is doing what. And if you terminate someone, then this account is no longer accessed. All of these things are very important, and that's why you need an individual account and a separate password requirement for each account.
And good admin controls there. That's a good point, right? If people leave, you need to be able to get in there and remove their account, and so that you can remove their access if need be.
Yeah, and we've seen that happen where somebody has left and still had access and has actually done damage to reputational as well as access some patient files and called them to move over to another dentist. So these things happen. Yeah.
What advice do we have for people around passwords?
Long and strong is the rule of thumb. So try to have an upper and lower case. try to make it something that you'll remember, so it's not written down in a sticky note at the front top corner. That's kind of dangerous. So keep it something that you can identify with and remember. Try to have upper and lower case and 8 letters or numeric values long.
Yeah, exactly right. And then, in terms of local, your rules and regulations, different colleges have some different rules. Different jurisdictions certainly have different laws that are required. So you need to be aware of what they are in your region and what you're responsible for following. So in Alberta, that would be the Health Information Act, and in the U.S. we have HIPAA, and California has their own rules now that require some differences. So how do people find out about that, and what are some of the considerations they need to?
Yeah, for sure. Search up to make sure your rules and regulations in your region are applicable and that you know them. But the key to it all is always around collection, use, and disclosure, how you're collecting information, least an amount of information required to do your job. And same as using information, use it for the purpose it's intended. You cannot collect this information and then use it to turn around and do marketing or try to do things that are not defined in your rules and regulations. So just do a little bit of research and make sure that your collection, use, and disclosure follows the rules in your state or in your province.
Yeah, great. So I just want to talk quickly about some must-have privacy features. I think there's some things that people don't, consider to be privacy features. I mean, when we work with clinics to do their privacy impact assessments, sometimes we'll come across vendors that are storing or providing access to patient information that don't have passwords. So there's no requirement to log in and view that information, which is incredibly dangerous, obviously. But you want to think about accessibility, right? You want to make it easy so that clinicians, staff, and patients that are using these services can easily do them. I think one of the things we look at when we look at other services people might use in terms of secure email, sometimes people look at using Microsoft Office and encryption. There's steps that you are relying on users to take to make sure that the information is encrypted and protected. And what we know is that the user is kind of the weakest link when we talk about that kind of stuff. What can you put in place that people don't have to change, that still makes it easy for them to access the information, so they don't try to find workarounds that aren't safe and secure, and then that's when we get into trouble. So usability is a big thing.
Yeah, a role-based access, right? You want to make sure that the roles that they're playing actually have the accessibility to the information they need. Otherwise, you're defeating the purpose. So for sure, you're right about the accessibility and the usability. You need it to be a workable solution.
Yeah,
and you can do that within the privacy framework. It is actually not as difficult as it sounds. So please be cognizant of that when you're, building your system and utilizing it.
Yeah. And then, of course, you want to look at that. How are we verifying users? How do you know that you're dealing with the right person on the other end? Is it just anybody on the internet can get in, or how do you know who they are? So that's an important thing too. When you're using a communication tool such as a secure email service or video conferencing service, that sort of thing, how are you verifying the identity on the other end? We talked a little bit about cybersecurity. You want something that has strong protections from a ransomware, spam, or virus perspective. You don't want something that's going to, provide access for spammers to your staff, your clinic, your patients, so that people are getting hit with more opportunities to click on something dangerous. You want to keep that out of people's way. In the event that something might happen, like a privacy breach, you want to be able to correct that. So how are you pulling information back? What steps can you take to sort of reconcile any of those events? Ingrid, do you have any input on that kind of stuff? What should people be looking for there?
Well, of course, the best thing is not to have a breach. So for sure, utilize a secure system is always the best methodology. Even if you are, let's say, not using a secure system and you try to encrypt or try to do all that, you're actually creating extra work and you're defeating the usability and the accessibility portion. If you've got a closed network of verified users, then the likelihood of your breach reduces again. So the key to it is prevention, of course, because correction is much more difficult. So prevention is the key to everything.
Yep, definitely. And you touched on encryption. We want to make sure that that's happening and that it's easy and that it's part of the service you're using. It's not a button you have to wait for people to press, and it's something that's going to be accessible on the other end. Encryption can be tough sometimes for the recipients, and a lot of times if you're using different systems, if you're sending from one system to the other, the receiving system might not support the level of encryption that's coming from your end. So you have to be aware of that stuff too. And then
Well,
team-based
and
engagement.
encryption codes. Yeah, you're correct.
Yeah,
And don't forget you have another layer in there. If you are using two different systems that are not compatible, then again, you have to send an encryption key securely. You have to then make sure the other person receives that information. Have to follow up with phone calls. Like, it's just not as effective as having
yeah.
it already built in, for sure.
And that's the kind of stuff that keeps people from using the services and finding these workarounds, and they just like, I'm just going to text them, and that's not something we want to support. So
And then
the
you
other thing,
go back to the lack of prevention.
yeah, yeah.
Yeah.
The other thing I just want to mention before we move on, and we're almost done here. We're running a little bit over, but it's an important topic. Is team-based engagement. You want a system that can involve everybody, right? If you end up using different systems and you're going back and forth and moving information from one side to another, and you use one way to communicate with some people you work with, other clinics or something, and then with patients, it's another system. You want something that's inclusive of everybody, so you don't have, these gaps as you try to move back and forth and you forget who gets what and what goes where. One system that's inclusive of everybody is important in that way. I'll just move on quickly and we'll talk about privacy compliance with SecureMail, just to kind of address some of the things that you have with your SecureMail account that you can use message recall. So in the event somebody sends somebody, the wrong person, the wrong information, you have the ability to recall that from someone. And using read receipts, you can look and see, hey, did that person read that? And if they haven't read it, Ingrid, you can clarify, but it's still technically a breach. But if there's no risk of harm because it wasn't seen or exposed to the wrong person, then that has different implications for reportability of that breach, because any privacy breach where there is risk of harm, you're going to have to report it. And we want to avoid that as much as possible, obviously.
Yeah, and then it also gives you the opportunity, if you see they haven't read it and it's something rather important, you have that trigger to respond and remind them.
Yes, yeah, of course. It's a great tool for closed loop. The other thing that Brightsquid has is everybody who's on the system has been identity verified in some way, so you know that you're dealing with the right Jenny Smith, and that's important. And you know that you're dealing with the right downtown medical clinic, and so that you have that, and you have the ability to attach any files you need, so you don't have to find another way. Hey, I sent you those files via this way. So for continuity of care, and being relevant in the process of providing care, you can have all the information stored in one place. SecureMail is also, as we say, HIPAA, PIPEDA, HIA compliant, all the regulations across North America and into Europe. SecureMail is compliant, so there's nothing that users have to do to keep it compliant. Just as long as they don't put any patient information where it shouldn't be, then everything's okay. So that brings us to the end. Ingrid, any last comments before we wrap things up?
No, but it's also good if you're looking at options to realize that, for example, we filed privacy impact assessment across Canada and US, that we have taken care of all the nuances. We've done our security breach protocol. And those things are important. If you are looking, those things are very beneficial to have the peace of mind to know that that portion is covered as well.
Yep, and that's something we do for our privacy subscribers on a weekly basis. A lot of times I hear the privacy team talking to people about new vendors they're looking at, right? Because we work with hundreds of clinics, we have a lot of experience analyzing, assessing the different software options that people have in virtual care and practice management, all that kind of stuff. So a lot of times we have already done an assessment on somebody you might be considering, or can help you do one to understand if what you're looking at implementing in your clinic is the right thing to do, if it is compliant, if it is secure. And that's an ongoing service provided to all of our privacy support subscribers. And if you want to get more information on that, or get a quick assessment of where you sit in terms of your privacy compliance and your breach risk, just do a quick privacy risk assessment. It'll connect you to the team to do a review, look at your score, and find ways that we can help you be more safe in protecting that data. So thanks everyone for tuning in today. Hopefully it was informative. This recording will be posted on our website under virtual care webinars, under the About tab on brightsquid.com. Have a great Friday.
Thank you. Have a good weekend.